this session. At the end of the webinar, you'll have time to ask questions. You can submit questions through the Q&A function within Microsoft Teams. There's a little bubble icon on the top of your screen that you can access the Q&A function. This is an exciting time for us here at Northern Health. As a health service, we're shifting our focus from hospital-based care. We're keen to deliver our services outside the hospital setting and focus on health and well-being in the community where you live. We're calling this our Staying Well program, and there's no better example of this than the Victorian Virtual Emergency Department. So without further ado, let me first welcome my first speaker, Dr. Lauren Sher, the Director of the Victorian Virtual Emergency Department, VDD for short. Thank you, Lauren, for joining us. We know how busy you are.
It's an absolute pleasure to be here, Mike.
Thank you. Along with me is an equally busy lady, Neela Konara, Director of Partnerships. Neela, before we come to the topic under discussion, partnerships at Northern sounds suspiciously like a dating app. What is it about, and what is it that your team does?
My partnerships role is really for Northern Health to work with our community organisations in the catchment so that we improve health and health outcomes for our community together as a whole health system. Like you said, we are keen to provide services closer to home or in home. We want to provide inclusive and accessible services to our very fast-growing communities and also the very diverse communities we work with. We want to improve efficiencies of our services as well. So we do a lot of work with our GPs, with our community health services, and I'm here today to support our latest partner, Priority Primary Care Centres or PPCCs in this catchment. It's really important to us that we establish a really strong foundation for these, considering how busy we are, and that because our community really needs urgent medical care when they need to see a GP within 24 hours.
Right. Thank you. It might be useful at this point to tell our viewers what's the difference between a non-life-threatening and a life-threatening emergency. Lauren, would you like to explain that, please?
Sure, absolutely. So what we consider life-threatening is anything that would affect someone's breathing, that they're really struggling to breathe. If they were, for example, starting to lose consciousnness, anything that caused severe chest pain or numbness down one side of their body, or if there had been an injury, if there was significant bleeding. These are the sorts of things we would consider life-threatening, and these are the things that you should definitely call 000 for. We are not suggesting in any way that you should contact the virtual ED or attend a PPCC in these instances, and should absolutely be contacting Ambulance Victoria to assist in these matters.
Right, thank you. Lauren, you and I go back some while, and I remember the time that you were working in the emergency department as a pediatrician, if I recall.
That's correct.
And then COVID intervened. What was that like? How was it being on the floor in that situation?
Mike, it was a very stressful time for us in the emergency department. It was stressful for us as clinicians, as doctors and nurses, because obviously we were concerned for our own health, and it was very tricky trying to work under difficult circumstances, wearing lots of PPE, having to follow lots of new protocols. And it was very challenging. But I think one of the biggest challenges at the time was recognizing the stress on our community and some of the adverse health impacts this had. We knew that patients were really worried about coming into hospital. They weren't sure when they should come into hospital. And if they were having a health issue, they weren't quite sure how to access the right level of healthcare.
Thank you. A related question. What was in it that led to the formation of the virtual emergency service?
So it is exactly that, Mike. We wanted to give Northern community a really good way of accessing sound advice about what they needed to do when they had a health issue. Did they need to come into the emergency department with that health issue? Did they need to, could they wait with some self-care advice and see their GP in the next few days? What were the other health services in the community that they could access, which would prevent them having to come into the emergency department?
Thank you. VBED has just hit 100,000 patients. What an amazing journey. How would you describe VVD today?
Look, it's a dynamic growing model. We are only, I think, scratching the surface of what we can achieve through video health. But I think fundamentally what I can say is that we are helping thousands of patients to access the right level of care in the right time and see the right type of health clinician for their problem. And I think that's a win for the community and it's a win for the clinicians.
Excellent. Neela, before I come to you, a housekeeping request. Can you please turn your cameras off, please? Thank you very much. Neela, back to you. You just heard about the role of VVED in easing pressure in ED. Where does PPCC fit into this?
So similar to VVED, PPCC also provide urgent medical care for people that's requiring GP attention within 24 hours. But it is also not for non-life-threatening, but for non-life-threatening situations, illnesses and injuries. And it is an in-person service.
Right.
So the Victorian government has committed significant investment to have established 25 centres across the state. There are 2 in our catchment in Epping and Craigieburn, managed by the Eastern from 4 Health and supported by the Eastern Melbourne Primary Health Network and also Northwest Melbourne Primary Health Network. They are, as I mentioned, different to VVED in the sense it's in person, where they have very highly trained doctors and nurses. Basic pathology and radiology is also available, and no appointment is required to go to these centres. Right. You can book appointments and you can book it via phone or online, or someone can refer to these services. GPs can refer to these services. And it is better if it is if you've made an appointment, so the staff is expecting you. They are open 7 days a week, extended hours from 7 a.m. to 10 p.m. It is a service free for everyone, and interpreters can also be accessed to do the consultation in your preferred language.
Thank you. Thank you, Lauren. Thank you, Neela. At this point, I'd like to call Kira McGraw. Kira works at Northern Health and, more importantly, lives locally in Mickleham with 2 young children. Kira has benefited from using both services and so is best placed to give us a first-hand account of how these services work for her. Kira, thank you for joining us.
Thanks for having me, Mike, and giving me the opportunity to share my experience.
So, Kira, VVED that you used first, would you like to tell us more about that?
Yeah, I used VVED. It was last year, around this time last year. My son was 4 at that stage. We were on day 5 with him having influenza. He had constant high fevers that I'd struggled to control with what felt like, a never-ending supply of Panadol. He was barely eating and only drinking a really small amount. We'd gone up to bed that night and I was changing him and I noticed a rash on his back and neck. And at that point, I was like, I don't know how to help him anymore. I knew I needed some help. I needed him to be seen. But I couldn't fathom going and sitting in ED for hours because I also had influenza myself and was really unwell. So I jumped on my phone, Googled VVED and registered for my son. We were directed to the virtual waiting room and within a few minutes we'd had our video triage with the nurse. We had a bit of a wait, then we were referred back to the virtual waiting room. We had a bit of a wait for the doctor's consult. When we spoke to the doctor, she was amazing. She instructed me on how to do the examination on my son. I was able to show her the rash over the phone, which was great. It was a really thorough consultation, and I really believe the advice she gave me meant that I could prevent my son needing to be admitted to hospital with influenza at that stage. That process, it probably took about 45 minutes. But I was able to endure that wait in the comfort of my own bed next to my son. It was such a relief. And yeah, I got an amazing sleep that night, not having to worry about this rash and thinking, I needed to take him somewhere.
Great. Thanks, Kira. Tell us how you got to use PPCC.
Yeah, and that was also for my son. I mean, there's always one child who tends to catch every little bug going around. So it was a Saturday morning, early morning. He was in bed watching his iPad like they do on the weekend. I went in to say good morning and I freaked out when I saw his face was swollen. We'd never had any issues with allergies or anything in the past, so it's not something we'd experienced before. And I think because of that, I was really panicked and I just wanted to rush him to a doctor, but I knew nothing was open at 7:40 in the morning. Um, so my first thought was, okay, Craigieburn PPCC is a lot less time for me to get there than it would be to drive down to the ED. So we headed in there and we were seen by the nurse within minutes of arriving. Very, very quick service. The GP came in a few minutes later and did a really thorough examination of my son. Thankfully, it wasn't that serious and we could get the required medication at their on-site pharmacy. And we were back home by 8:30 and my mum anxiety was relieved. Yeah, both instances, I was really satisfied with the service and the fact that I didn't have to sit in ED for hours with a sick child was amazing.
Thank you, Kira. That's amazing. Thank you for sharing your story. It's great to hear the positive impact these two services are having in our community. Thank you once again for joining us, Kira.
Thank you.
Back to Lauren and Neela. After listening to Kira, I have a question to clarify. In which situation do you use either VVED or PPCC? Lauren, would you like to go first?
Yeah, thanks, Mike. I think if you have access to technology and you know how to use video technology, I think ideally you come through VVED first. And the reason I say that is because we just have such a good working relationship with the PPCC anyway.
Okay.
So if one of our doctors has done the consultation and things that you do in fact need an in-person consultation, we will contact your local PPCC, speak to one of the doctors there and confirm that they're happy to see the condition, and then we'll actually assist you with your booking. So it doesn't matter if you come through the VVED and you land up with a PPCC appointment, but we do know a lot of patients can be managed completely through video health, as we've heard with Kira's story. And for a lot of those patients, we get to keep you at home and organise management for you in the community. We can organise e-scripts to your local pharmacy, pathology and radiology. So there's a lot that can actually be achieved through video health.
Just out of your home.
Yes, exactly.
Thanks, Lauren. Neela, what would you like to add to that?
Yes, similar to VVED, but we are an in-person service as mentioned. It is again for people who are requiring urgent GP care within 24 hours for when it's not life-threatening situations. And it could be for conditions like mild infections, burns and suspected fractures. Again, we recognise the difficulties in this catchment to access a GP within 24 hours, and VVED and PPCCs are both options for that situation. And really, as Lauren mentioned, it is especially good when you can't access the internet or a webcam or don't have the language skills to access a virtual service. And again, accessing PPCC will mean it's quicker than waiting at our emergency department. Similar to the emergency or VVED, you will be triaged according to the severity or the clinical need, but still it is much less demand at PPCC than the emergency department.
Okay. Question that arises from that, what happens to non-English speaking audiences, starting with VVED? How do they use VVED?
So if you register for the VVED, you will automatically get the registration form in the language that you use most on your phone, and you can register in your own language. You can also tick that you want an interpreter, and we can organise to have an interpreter come into the consultation with you and do the consultation with the doctor. So we offer up 22 different languages and catering particularly to the northern catchment's most regularly spoken languages.
Excellent. How does it work with PPCC, Neela?
We are accessing test interpreter services, and interpreters will be accessible by phone. Or otherwise, we may be able to organise in person, but it is mostly over the phone.
Thank you. Listening to you too, I think there's an important point. Two services really complement one another. One feeds off the other. Would you agree? It's about right patient care at the right time. Is that what these two services, how they work in tandem?
Absolutely right. And as I mentioned before, Mike, if you come through the VVED and we think you need PPCC, we will absolutely help facilitate that appointment.
And what both of these services do, Mike, is really to relieve the pressure from our busy emergency service and make it available for patients who really are in life-threatening situations, and also take the pressure off our very busy doctors and nurses.
Okay. I think now the last and burning question is, how does one use VVED? Lauren, would you like to talk us through that, starting with the website that I think is right now on screen?
Yes, absolutely. So you can go through to our domain, which is vved.org.au, and click on the patient icon where it says, "Are you sick or unwell?" And that will take you through an electronic registration process where you'll fill in all the information you would normally give if you went into an emergency department. All this information is secure. And once you've finished registering, you'll receive a link where you'll click on the link, enter your name, your phone number, again, so that we can identify you in the virtual waiting room. And then when you're next to be seen, we'll click on you and start the consultation.
Excellent. Neela, would you tell us how we can access PPCC, please?
Yes, we can access PPCC in person, walking in, or by phone or online. And there are two services in the catchment, as mentioned. One in Craigieburn, in the Craigieburn Medical and Dental Service, 70 Central Park Avenue, Craigieburn.
Right.
Epping Primary Care Centre is in Epping Plaza in the shopping centre. It's shop 216, where Epping Plaza Medical and Dental Service is located. Both are co-located within existing medical centres, Mike, but as you walk in, there are clearly marked PPCC reception areas, so you won't be able to miss it if you're at the entrance. As mentioned, they are open 7 days a week, extended hours 7 a.m. to 10 p.m. Obviously accepting referrals, walk-ins, and pre-booked appointments as well. And so you should be now able to see the web links on the chat.
Right. So that's very convenient. We're talking about Epping Plaza just across the road here. Thank you, Neela. Last question for you, Lauren. What does the future look like for VVD? Where does VVD go from here?
Well, Mike, as you may know, we've become statewide, so we're currently servicing the state of Victoria. So we've already gone quite big. And really what we're looking to do is identify the key needs of our community. So most recently we launched our virtual kids waiting room, recognizing that, children are a special subsection of the community, and that is now serviced by pediatric specialists.
Right. I think that wraps up the main part of our presentation. If you've got any questions, you can post them on the Q&A. But otherwise, I'd like to end by thanking our partners. Once again, couldn't have done it without you. And I'd also like to thank our presenters here, Lauren and Neela. Thank you very much for joining us today. Last but not least, thank you to the amazing crew behind the controls here, Jessica, Steve, Christina, and Emma. If you have any feedback or have questions, please email us. Our details will be displayed on screen. A survey will also be emailed to all our audience members and to those who registered for today's event. We appreciate your support in filling out the survey. Thank you for joining us. Enjoy the rest of the day. Stay safe, kind, and together.